I am describing my go-to cataract procedure, which I have called the flip and slice technique. Basically, it is a supracapsular cataract disassembly technique. Here I am placing some preservative-free lidocaine in the anterior chamber. Now I am going in with AMO's new Endocoat OVD. It is a crystal clear dispersive OVD to protect the corneal endothelium. Immediately under it, I am putting a sandwich of Healon5 to create my working space. And immediately underneath the Healon5, I'm going in with BSS on a 30 gauge cannula to create my working space for the capsulorhexis. Now I'm making my main temporal corneal incision. I'm using a steel keratome, and I use multiple kind of tongue and groove type of an incision for better sealing at the end of the case. Here I'm going in with my cystotome to puncture the anterior capsule and to begin my capsulorhexis. I use a Utrata forceps for my capsulorhexis, and it has two hash marks on it, as you can see, at the 2.5 and 5 millimeter marks, so that I can gauge the radius and the diameter to try to get as perfectly centered and perfectly sized capsulorhexis each and every time. I look for a 360-degree overlap over the optic of any IOL that I'm implanting. And here the capsulorhexis is complete. The next step is going in with a flattened hydrodissection cannula to very, very gently hydrodissect and hydroprolapse the nucleus out of the capsular bag. And as you can see, the cataract is popping out of the capsular bag about 2/3 of the way. I'm going to go in with my Healon5 right now and put a ribbon of Healon across the equator of the cataract to deepen my working space and to protect my corneal endothelium. I'm using a Koch manipulator to slice and flip, hence the name, flip and slice the nucleus towards me. If the nucleus is sliced, then I start on the quadrant setting of my White Star Signature phaco machine. If I couldn't fully slice it, then I go to the sculpt first, and then I go to the quadrant. Here you can see for the nucleus removal, I use peristaltic for its holdability. It does an amazing job of holding the fragments with very little retropulsion, repulsion, and very little chatter. Next, I'm going to use my IA with the Venturi setting. Venturi is known for followability. So I want the sticky cortex to follow and come into my port without engaging the lip of the anterior capsule or the posterior capsule. The followability of the Venturi is very, very smooth with very little power, very little water pumping through the anterior chamber. I'm able to remove all of the cortex, especially subincisional cortex, which can be sticky. The Venturi also works well for any of the little strands of cortex that are often tethered to the equator or the posterior capsule. Next, I'm using Healon Regular to inflate the capsular bag. I'm going to now start the Iol implantation. So the implant is going in. I try to do the least amount of maneuvers inside the eye to minimize any complications. So within one fell swoop, the implant is in and both haptics are in the bag. For OVD removal, again, I use a Venturi pump for its followability. I don't have to tilt the optic and go underneath it. No intracameral acrobatics are required. The Venturi system beautifully removes the OVD very efficiently and effectively.